Good day, everyone. The topic of this lecture is dentin hypersensitivity. Dentin hypersensitivity is defined as a short, sharp pain arising from exposed dentin in response to stimuli, typically thermal, evaporative, tactile, osmotic, or chemical, and which cannot be attributed to any other dental defect or pathology. Globally, the prevalence of dentin hypersensitivity ranging between 4 to 74% according to different studies, while the incidence is ranging between 10 to 30%. Out of 7 adults attending dental clinic, one of them is suffering from dentin hypersensitivity. This condition affects female more than male and affects people at a third decade of age, which is between 30 to 40 years more than other age groups. According to the teeth, canines and premolars are the most affected teeth, and in these teeth, the cervical area buccally is the most affected area. The etiology of dentin hypersensitivity is attributed to the exposure of dentin due to removal of enamel covering the crown of the tooth or removal of the cement and overlying periodontal tissue from the root surface. Enamel loss can be due to several reasons such as attrition, abrasion, or erosion, while cementum loss can be due to other conditions such as gingival recession, chronic periodontal disease, or physiologic causes, or following periodontal therapy. It should be noted that hypersensitivity initiated after periodontal therapy is transient and it reaches its peak during the first week after treatment, and normally it will subside and disappear within a few weeks. However, sometimes this condition may persist as a chronic pain and that needs attention and treatment. In this diagram, you can see the open dentinal tubules, the dentin. Further magnification shows these tubules, and this in the vital tooth contains the process of odontoblast cell and the associated nerve that's responsible for provoking dentin hypersensitivity. Many theories attempt to explain dentin hypersensitivity. The first one was the direct innervation theory, which states that the nerve endings penetrate the whole thickness of dentin to the surface and that they will receive the stimuli directly from the outer environment. The second theory was the odontoblast receptor, which proposed that odontoblasts will act as nerve endings by themselves. However, both theories fail to provide an accepted model for explaining dentin hypersensitivity. The last theory, which is the hydrodynamic or fluid movement theory, states that the inward and outward movements surrounding the odontoblast processes will stimulate or transmit the signal to the nerve endings at the dentin pulp complex, thereby provoking the pain. And recently, it is the most accepted theory to explain this condition. Diagnosis of dentin hypersensitivity starts with taking a thorough history and then examination of the dentition to exclude other possible reasons. For example, tapping the teeth vertically and laterally to indicate or exclude other conditions such as pulpitis or periodontal abscess. Second examination is by detecting pain on biting a stick, which could be a wooden or plastic stick, which suggests a fracture. And then we have using of trans-illuminating light or dye to diagnose a fracture. Simple clinical methods can be used to diagnose dentin hypersensitivity, including jet of air using a triple syringe in the dental chair, or bypassing the dental probe over the exposed area in mesodistal direction. The principle for treating dentin hypersensitivity is based on using different types of desensitizing agents that either occlude or reduce the diameter of dentinal tubules, which thereby minimize the fluid movement in these tubules and hence reducing the pain. Desensitizing agents can be classified according to mode of administration, either at home or in-office desensitizing agent. The major difference between the two techniques is that At-home therapy usually takes longer time, between 4 to 8 weeks. The other way of classifying desensitizing agent is on the basis of mechanism of action, either nerve desensitization, anti-inflammatory agent, or covering or plugging dentinal tubules. However, in severe cases, root canal treatment or even extraction may be indicated in severe cases. Thank you for your listening.